think we should start with the cheers.
Okay, let's do it.
Cheers. I guess I'll take a drink too.
Yeah. Let's talk home exercises.
Oh, it's great. I love the challenge. Yeah, so home exercises. I think that everyone has this ideal that they're going to start care and just their spine's going to be amazing after 1 week of care in our office, and they'll never have to do home exercises or never have to work on it again. But the reality is that in the 21st century that we live in, having a good, healthy posture and a healthy aligned spine is probably one of the hardest things to do.
It takes some work, for sure.
Yeah, I think everything that we have in our society is kind of pushing us away from that. So let's talk why. Let's talk, what having a healthy aligned spine and posture does for you. And then I really want to hear from you on this because you're kind of the master of it. The tips and tricks for doing home care effectively, in a timely manner and making sure that you get all your reps in. Awesome.
So let's jump right in, get into the why we recommend these home exercises for our patients.
Yeah. So home exercises are extremely important. 30 to 50% of the correction that we're going to get in your spine is from what you do at home. Unfortunately, whenever we adjust your spine and align it well, after that, your body's muscle memory and the memory of the ligaments that are around your spine, inadvertently, they're going to pull you back to where you were before. And so whenever we're working on aligning someone's spine properly and getting it healthy, we're always fighting our body's muscle memory. And so what exercises do at home is they help stop that backslide that happens in between your adjustments in the office.
So the adjustments help to move the spine, get more mobility, help with nutrition.
Yes.
And then the exercises are setting that in place.
Yeah. So the adjustment process, like when someone leaves our office versus coming in, their spine should be actually sitting in a better alignment. And then, we go back to sitting at a desk and looking at a computer and our spine starts to tail back. So exactly right. Those exercises at home are there to do as much work as possible to stop that backslide. We can't jump out of your closet in your house and adjust you halfway through your exercises. So those are the things that help with that.
So it's a subtle change to the old pattern,
yep,
which we can be proactive and actually achieve.
Yes.
Which I love that concept. It empowered me when I looked at my home care exercises and said, oh, I can do this every day.
Yep.
And I'm reaching towards the optimal spinal alignment that I can get. Like, that's empowering.
Yeah, for sure. It takes around 4,000 what are called NREMs. They're neurological.
You're getting fancy.
They're neurological repetitious exercise movements. Researchers estimate that to change the alignment of a body part, it takes 4,000 sets of repetitions of that. So think about it. If you're doing, 1 or 2 a day, that might take you 10 years. The reason that, max living chiropractors, especially ones that do the training that we do in corrective care, the reason that we can see someone's spine change in 4 to 8 weeks, whereas when we went to school, our teachers would tell us, you can't change a spine, The reason that we can do that is by doing all of these little things correctly in there. So the warm-up adjustment and vibe is way more effective than just one set of exercise movements. It's hundreds of sets by doing it that way. The home exercises, again, stacked like they are like a catalyst that helps rapidly get you better results overall.
Yeah, one of the hardest or most challenging parts for me was just how do I fit this into my day?
Mm-hmm. Yeah, I'm already coming to the office. I get kids, I got a wife. How do I?
So we're going to have dinner. How am I fitting this in? And the number one thing is we've handled thousands and thousands of different scenarios. And that's what the team is here for, is to help each and every patient get through those obstacles so we can just be their guide, because it can seem overwhelming at first, but there's definitely some tips and tricks to make that much easier than when you first get that home care kit and your exercise sheet. It can be overwhelming, but we're here for you.
Yeah, for sure. For sure. So I think let's jump right into it. I think that, I want to know your tips and tricks for doing it. I've got some little secrets up my sleeve for how I keep my posture good on a daily basis.
Oh, you start us
let's rock into it. Well, the big one for me, I always struggle to wear my head weight. And so I had to develop a routine that was with my daily life that helped me actually get my repetitions in. And to be honest, the one I struggled with the most was in the morning. But really the morning is when you want to actually warm your spine and body up. I'm no different than anyone else with a spine. Like I have back issues. I have 2 blown discs in my lumbar spine. I'm bent over a table all day long. So I made it part of my daily routine. So when I go to put my clothes on in the morning, my traction unit hangs in my closet. So I do traction right when I wake up. I do my isometrics. I have a couple specific ones that I do, the resisted head one. And then I have some lunges I do for my lower back. I do that right as I wake up in my closet, like right before I go brush my teeth. And then when I brush my teeth, my head weight sits right next to my toothbrush. And so head weight goes on, teeth get brushed. I may not do the full 5 minutes sometimes, but I'm wearing them there. I'm washing my face, things like that. Then I take my head weight off. Then I do my hair. And then I'm set for the day.
Yeah, you don't want to put the head weight on after you do your hair. Come on.
No, I love the people who come into our office. They're like, you guys are professional hair messer-uppers. Like everything you do just messes up my hair. So do it first.
Yeah, I like all of those. I like to lie on the floor with my foam wedges underneath my pelvis first.
Okay.
Just to work on that as that's my number one, I guess. And also wearing the head weight and just marching with my eyes level to the floor. Just moving my body in the morning. I have much easier time in the morning than the evening routine.
Okay.
And one other thing is while my coffee, I just do French press coffee. So while that's taking 5 minutes to steep, or if I do tea, I'm wearing my head weight and just marching, just moving with my eyes level. And that 5 minutes that I normally would maybe be on my phone, I'm not on my phone.
Right. I think everyone thinks you have to go into a room and sit by yourself and stare at a corner with your head weight on or while doing these exercises. And really you can incorporate them into your daily routine, and it makes it so much more, obviously doable.
One tip also would be you don't have to complete the entire list at one time. You're upstairs, you're getting ready, you're having that done. And then maybe you have your home traction unit in the basement. So you would just go do that second, after you get dressed, or you'll come up with your own flow, and you're going to figure out what works for you and just roll with it. And there's really just use your imagination is one of the best advices I received from the team member that went over my home care kit was you're going to develop your routine. If it's working, you're doing it. Just rock it out.
Yeah. I think another big tip too is think about staying moving well throughout the day. There's research showing that most adults are the exact opposite of what their movement pattern should be. We are supposed to be moving 12 hours a day and sitting 4. Most people sit 12 hours a day and only move for 4. So, adding some exercises in, if you have a desk job or things like that, have your wobble disc at work with you, or if you're working from home, have your wobble disc there. Every hour or so, throw it in for a few minutes and be actively moving your body, as you're doing work or as you're getting through your day. If you're driving in a car, you can press your head back up against the headrest.
Yeah, I was
the
going to say
exercises
that.
in the car.
That's one of the easiest time savers. Is you're at the traffic light, you can just put your head against the headrest and do an isometric, and you can put your hands on your forehead and do the same for your flexion, and you're getting those extra repetitions in, which are going to make the world of difference in the long term.
Exactly. I think sometimes people get frustrated, and I think they feel guilty. I think people almost feel like they disqualify themselves either in our office or with their health because they didn't start right away with their home care, or because, they missed an adjustment or two here or there. Or if you're working with a personal trainer, you got off track for 3 weeks. Health is about, daily decisions. And this is a marathon. We're not done with our health tomorrow or next week or next month. We're going to be working on our health and keeping ourselves progressively trying to get better throughout every course of our life. So, the big thing is starting small is still starting, and adding those routines in one by one, that's how greatness happens. No one starts care in our office or starts a new program and automatically becomes an expert where their whole life changes. We pepper in those exercises one by one, and then we form those habits. And that's how we really get ourselves to accomplish all the 5 essentials over the long run, where we're eating well, exercising properly, doing the home care exercises, getting adjusted, detoxing. It takes time to do those things, but as long as you're just give yourself grace and work slowly towards it, I think that's the secret to really helping to do all these things. And
One of the most amazing smiles I've seen. It was about a week ago. Joni looked at me after I showed her X-rays after 4 weeks of care.
Yeah.
And she was like, wow, those exercises work. And it was just high five time, just celebrating where she had started versus where she was. And she had made some significant changes. Not only her forward head carriage improved significantly, but the curve in her neck. So she understands that getting adjusted and doing her home exercises it's helping her symptoms, but it's also the reason why she's coming into the office is for her long-term health, to keep her spine healthy for a lifetime.
Yeah. Yeah, smart. I mean, we don't stop doing the things, or we shouldn't stop doing the things that build health ever. You know, you don't stop working out once you're in shape. You don't stop eating healthy once you get, your body to where you want it to be. You should continue to do those things regardless of how you feel. We're doing another video coming up on the regenerative aspects of chiropractic care, how beyond just, pain and feeling good, chiropractic helps you. And in the last 10 years, there's more research supporting a healthy spine and a healthy nervous system as really one of your biggest keys to longevity over almost anything else. A healthy spine gives you a high heart rate variability, which is directly associated with longevity. It increases vital capacity of your lungs. It improves your body's overall immune system and function, reduces surgery risk, reduces risk for medications and hospitalizations.
All those sound amazing.
Yeah. People who get adjusted have the least missed days of work. And hey, if you're still healthy, maybe fake being sick, but at least you won't be. You know what I mean? So that's the whole idea behind it, is like we want to continue doing these things. Wellness adjustments, staying healthy, doing the home exercises, getting on board with nutrition, whether it's the core plan, advanced plan, the metabolic coaching that we have, engaging yourself on a daily basis and saying, hey, every month, how do I get better? How do I get better? How do I implement more?
I just encourage everyone to just ask questions of any team member is going to be willing to help you. We promote ourselves as being problem solvers. If you have some issue with your over-the-door traction unit, it's just not working quite right, please tell us. Please tell us.
Tell us.
Because we need to know those things so we can help you. And so you're having that smile of just self-encouragement with, after first 4 weeks, let's see what your spine looks like. Oh, we're on the right track.
Yeah.
And then we can start reaching towards those other essentials. But starting with the nervous system is first and foremost what makes us different. And I love it.
Yeah. 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 We care too. When your x-rays look great, we're excited. When they're not, we want them to be better. We want to see you progress in your health. We want to see, those reevaluation forms filled with, I'm breathing better, I'm sleeping better, I have more energy, I'm losing weight, I'm, building muscle, my brain's working better. We want to see all those big things. And we know that by committing and implementing these things well, that we're going to achieve those. So.
One of the great resources we do have, certainly sit down with each patient, need it and go over their home exercises and their kit. But on our website, there's links there to show you someone doing them.
Yep.
And a picture is worth 1,000 words, and it helps someone, oh, I understand now. And again, so we have that there, or just ask any team member.
Yep. Love it. Cool. Hey.
It's a wrap.
Thanks for doing this.
Yeah.
Cheers to home care.
To home care.